Welcome to HCA Talks Health, brought to you by Health Coaches Academy, the UK's leading health coach training academy. I'm your host, Zina LaRue, a certified health coach, and each fortnight I'm joined by experts from across the health and well-being space to share insights, ideas, and practical tips you can use to improve your health and everyday well-being. Welcome to HCA Talks Health. My guest for today is Izabella Natrins, and she is the CEO and Board Executive Director at UKIHCA, which is a professional body for health coaches in the world. Izabella is also a health research psychologist and a registered health coach. So welcome, Izabella. It's lovely to have you.
Thank you very much, Zina. Thank you for inviting me. And it's a pleasure to be here today with HCA, who have done and are doing some groundbreaking work around the world. So congratulations to you guys and looking forward to our conversation.
Yes, me too. And what a privilege to have you on the show today. So thank you for taking the time. I want to start with your own background. So please tell us a little bit more about your own background and also how you ended up as the CEO of UKIHCA.
Yeah, it was a moment of weakness, I think. But I'm very glad for that moment of weakness. Okay, so I guess to start, I have, around 40 years experience in the health space, wider health systems and, in the corporate space as well. My career spanned from frontline care as a nurse through research, through national program management, program leadership, public and corporate leadership, governance, management consultancy, organizational development consultancy. And always really with a focus on people and how what we do in our systems affect people and how we can either develop them, train them, educate them, create cultures that embrace people and that are meaningful to the customers or the clients or the public, depending on the sector, really. So I've always been people focused, really. How did I get here? I guess, I qualified in psychology and not intending to be a clinical psychologist, but I was quite interested in it. And I was really interested and quite gifted in research. So I could crunch much to my utter surprise. I was able to crunch numbers, which I never knew I could do. And found myself working at the University of Birmingham as a health research psychologist on a child development study in the Department of Public Health and Epidemiology, which, by the way, used to be called and should be still called the Department of Social Medicine, which makes much more sense to us at the end of the day, I think.
Yeah.
From there, then I went on to the NHS and various roles, and then into the private sector as a management and organisational development consultant. And then I got fed up. And in truth, my health wasn't best. The wheels were falling off. And I decided to take a step back from all the corporate pulling out of my brains every day, every last bit of whatever was in there still. And decided we'd always been a very big food family. My parents were European. We always had great food on the table. My mum was a brilliant cook and family in hospitality. So I've always been around food and cooking. I decided that I wanted to train as a real chef. And everybody said, but you can already cook. I know, but I just want the experience. So I found myself at Ballymaloe Cookery School in Ireland, training to be a chef and finding to my astonishment that I had come to a real food haven. It was an organic farm. We were taught classic French culinary techniques within family dining style. So it wasn't sauces one week and then something else the next week. So it's really, really interesting. And above all, it taught us to respect where our food comes from, how it was produced, And key to this, that food and health starts in the soil. The quality of our health starts in the soil that it was grown in.
Mm.
And that is key. So I came back inspired, started a small cookery school of my own called Once Upon a Cook,
Yeah.
teaching people to know what an ingredient is and distinguish between an actual ingredient and a bottle of sauce that you added to something else.
Yes.
Where to get these ingredients and what to do with them when you got them home. So I did that for a little while. That led to, long story short, training in nutrition. And then I realized I didn't want to be a nutritional therapist. What I liked was the health coaching bit.
Mm.
So I did my health coaching qualification, came into the association as a volunteer
Mm.
during COVID, and suddenly found myself asked to join the directors because of my background. Everybody thought I was really, smarty pants. So I gulped and said, "Oh, all right then, will do." And here I am ever since. So I came in as professional standards director, and now, and then within a year, I took the chair
Wow.
of the CEO, and here I am stuck in this chair for the last 6 years, and life goes on outside, but it's brilliant, and I love it.
You know what I like most about everything you said is despite everything going on and you being in this amazing role as the CEO of UKIHCA, you still have a brilliant sense of humor.
Oh, well, thank you. I think you've got to retain it though, because
Yeah.
I mean, come on, people, let's face it. If you just concentrated on the serious side of, I
Yeah.
think you'd find me hanging from the rafters, wouldn't you? Because I mean, our health, our populate globally is not in a good place, which actually is the one thing that inspires me to keep going because I know how much of a difference that this profession, this discipline, and the coaches that you train and that we credential and welcome into the association, they are the future of health.
Yes, absolutely.
Yeah.
Let's talk a little bit more about that. So, thinking about your mission or your purpose at UKIHCA, how would you describe that, or how can you share that with our listeners?
Yeah, well, we've published our vision and mission, and I must say, the association was established in 2018, so we stand on the shoulders of the giants that did what they could with what they'd got at the time. So we're very grateful to all the past directors and the CEO and everyone and all the many, many volunteers that have been involved along the way. And they created a vision which we have revisited a few times and we've never wanted to change it.
Mm.
So our vision is to see a self-empowered population managing their health and well-being to thrive in life. So
Mm.
that's what we want to achieve. And we want to do this by seeing a registered health coach in every context, in every health care context, in education, in the workplace, in communities, in physical activity centres, in leisure centres, in spas, anywhere where people are, where they need some support to make the best choices they can to improve their health.
Mm. Beautiful.
That's our vision and
Mm.
our mission. And how do we do this? We through advancing professionalism really in this discipline. So that's why we're so committed to professional standards, education, training, CPD, um, creating, supporting the schools who are delivering the coaches to our door to become skilled professionals with parity, with the same level of respect and understanding as other practitioners
Mm.
in health and care, but more widely in society, really, because we need to see health coaches everywhere. It's
Absolutely.
not just in health spaces. Yeah.
You've mentioned earlier that you have quite an interesting and elaborate background. You know, you were trained as a nutritional therapist and a cook and everything, but still you found that that role of the health coach is really important. Tell me more about this. Why do you believe so much in the role of the health coach?
Um, I think because many of the other disciplines are, all of them are really important. You know, all of the other professions are important and they're specialists in their own field, and so they should be. But their focus isn't on behaviour change, it's on delivering care or delivering a therapy or an intervention of some kind. What's special about health coaching is that we don't do any of that. What we do is give our clients, our patients, the opportunity of reflecting on their own life. They are the experts in their own lives. We're not the experts in their lives. What we are experts in is listening, considering, thinking, helping people find solutions that they already know are there. And if they can't voice these solutions, then we can help them with the right kinds of communication skills, tools, techniques, exploratory conversations that really help people dig deep into what's important for them. What is their purpose? What do they want to achieve around their health? And what steps can they take or have they taken before, and that we can support them on to achieve that. And we know that health is multi-dimensional. You know, so many health challenges that we face today are not acute conditions. Many are, but most are chronic and long-term conditions. Or we're thinking about people who are conscious that they don't want their health to deteriorate, so it's about prevention. So we know that lifestyle, stress, environment, social conditions, emotional well-being, you know, all impact on their behavior and their ability to actually be a reflective practitioner in their own health. And that's what we're really building, aren't we? We're asking for a self-empowered population that are literate in their own health, and which is a hugely important role for health coaches to help people build health literacy, and to then, you know, not give them more information, but to support them to cultivate connection, that relational relationship that we've lost really, as many other healthcare practitioners now are focused on the delivering of the treatment or the you know, the intervention. But that human connection, understanding, you know, helping people find sustainable ways of creating change within the reality of their own lives. So it's that human side that matters enormously to me.
Yes, absolutely. And that's so important. I think many people, when they go for a consultation with a health professional, they expect to be fixed. You know, they're going to be a passive participant instead of actively being part of their healing journey. But I love what you said about it's a self-empowering journey. When you work with a health coach, it's about building that health literacy. So our communities can be more informed, and it's there's just a different spin to that, right? Compared to maybe the typical medical model.
Yeah, absolutely. And I think, you know, that is the point. It isn't about fixing people. Um, it really is about helping people to have that confidence and self-knowledge, but also to be aware of their options, you know, so that they can actively participate. I mean, we're very committed to, you know, the self-empowerment model. And I think that's substantively different from empowering patients or clients. Because when we empower somebody, it comes with this notion of we give them something. Yeah, we give them something from us to them. We don't think that
Yeah.
at UKIHCA. We like to say, we prefer the term self-empower, because it's building up everything you need to become that active participant. It's not us doing something to somebody else, empowering them with this or that. It's this really, it's a nuance, but it's so important, and it really frames the way that you would approach a consultation with a client as a health coach.
And the irony is that it's often more sustainable when someone through that process of self-empowerment realize, oh, this is what I need to do, or these are the next steps for me. That's often what creates the lasting, meaningful change.
It does, yeah, absolutely. And I have an incident, an example when I was practicing, which I don't practice because it's got enough time in the day. I
Yeah,
wish I could.
imagine. Yeah.
But some years ago, when I was practicing, I had a client who really, really, she was struggling. And she went through, it wasn't a program, but she went through quite a number of sessions. And she had a lot of information. She had a lot of stuff, a lot of resources that I shared with her. And she really transformed her health. Then I met her at a conference actually, and she said, "Oh, it's you. I've been meaning to get in touch with you." And I said, "Oh, how are you doing?" And she said, "I need your help. It's all unraveling. It's terrible, and this and this and this." And she said, "When can I make an appointment?" And I just said, you have enough information. You don't need any more information. Don't need. What I'd like you to do is go back, find it all. If you can't find it or you've deleted it, I will send it again.
Mm.
And when you've read it, if you still need me, please reach out.
Yeah.
Well, about 3 weeks later, she said, "Thank you." It brought back everything I already knew how to do. And that's what we should be aiming for,
Yes.
you know.
Not relying on someone else
No,
to
and not
fix it.
creating a dependency
Yeah,
because,
exactly.
Zena, look, there are millions and millions and millions of people in the world.
Mm.
There's no competition. We are health coaches that don't need to worry about, oh, will that client come back, or, we need to grab them. No, because what we need to do is get the message out there that
Mm.
we are available to everybody wherever they are in the world.
Yeah. And that's part of your vision. You said that you would like to see health coaches part of every system, even at spas or in
Yeah,
medical
yeah, yeah.
setups. But what role do you think health coaches will play in the healthcare system, maybe over the next 10 years?
Oh, well, I think it's absolutely every role. I think are looking at an increasingly important role in prevention, in supporting lifestyle medicine. We have lifestyle medicine. We know how powerful it is, but at the end of the day, it can't just be a prescription. Sleep better, move more, eat better. It has to have the behavioral support. So for me, lifestyle medicine and health coaching are hand in glove.
Mm.
So, the glove is the lifestyle medicine. That tells you eat, sleep, move, do whatever. Yeah. The health coaching is the hand in the glove. It's what makes those fingers move and happen.
Absolutely.
So it's a really symbiotic relationship. And I think we're going to see, and this is certainly where we're positioning health coaching at UKIHCA, is that it's part of population health. It's a fundamental part of population health. We've just written several papers on positioning health coaching as part of public and population health, and looking at how health coaching needs to be integrated into systems generally. So we see them in workplace well-being. We see them in community health, in the new neighbourhoods, in rehabilitation, in long-term management conditions, and of course in mental well-being support. Not that we're, hoping that coaches are going to be quasi mental health workers, but as you know, all of those lifestyle conditions interact to
Yeah.
affect every part of our physiology, psychology, sociology, all of it.
Mm.
So it's this interaction and where we can sit at the interface of all those different areas and have a lens on those.
Mm.
So we are useful in all of those areas and increasingly will be in occupational health
Yes.
and well-being.
I like how you explained it. We know health coaches with the hand in the glove because it's about implementation. It's about knowing what we're supposed to do, but then helping someone think about that why and the barriers and the practical implications of doing,
Yeah.
taking action, not taking action. So we've actually had quite a few students who are clinical psychologists, even now that you're saying we're not going to replace mental health professionals, but saying that yes, the work they're doing is of course extremely important, but there's that practical implication that's missing. Now that you know this and now that you've worked through the trauma, what is the next step? So there's a
Exactly.
beautiful merging of these professions that could also be extremely useful. But I think something that we really need to think about, and of course that's what UKIHCA's role, that's one of the most important roles, is accreditation. Right, so many people are using the term, maybe, I'm a coach and I can support you, or I'm a health coach. But what separates a well-trained health coach from someone who is perhaps saying, I can help you, I can support you? What's the difference?
Well, it's the difference between trust, safety, um, and possibly the Wild West. Now, I'm not suggesting for a moment. Look, when I was working with a nutritional therapist before I did my nutrition training, I was health coaching. I didn't know I was health coaching. I just knew that I was drawn to that, helping my clients find ways that they could implement Kirsty's advice
Mm,
and suggestions and recommendations for nutritional recommendations. So my role really was, well, how could, not about supplements, but about the kinds of things that they could eat, that they could be putting on their plates, but they say, oh, I don't know how to do that. So that was a really interesting role that people, you could see the kind of scales fall from their eyes and
mm,
the lights go on, when it was darkness, like, wow, we can do this. So I think that there are many health coaches out there who are safe
mm.
because they have integrity, but we can't rely on that, as you know. And this profession has had a lot of bad press because of the Wild West and the Instagram health coaches, who are more interested in their gym kit than they are on. They're all thin, like nobody else is thin. Why are you so thin? So it's about kind of really, really putting the stake in the ground and saying the difference is safety. It's evidence-informed practice. It's ethical standards, it's professional boundaries, it's scope of practice. It's based on science, on behavioral change science. It's based on really keen and important communication skills, not about telling, but about listening and receiving and reflecting. It's about focusing on you as the client or the patient, not on me and what I think I can do for you. Yeah. So it's not it's the difference between someone who's trained in a whole host of really high level skills, behavioral change theory, motivational processes, active listening, coaching psychology, trauma awareness, accountability and support, ethics, safeguarding, cultural sensitivity, recognizing when to refer on, when you cannot help that client and should not be trying to help that client.
Yeah.
This is the distinction between a health coach. It's not regulated. It
Mm,
never will be, but we are self-regulating as an association, and that's why we've created the standards that are world class, why we have the CPD requirement, the supervision requirement, the very, very clear scope of practice, and ultimately, of course, the register. So those coaches that wish to join the register must and are expected and are mandated now
mm,
to uphold certain requirements so that their peers, the public, their peers, their health, the health people in the health professions can recognize that they are true professionals.
Yeah.
Also, of course, employers, because what employer wants to take a chance on an Instagrammer?
Yes,
Not
exactly.
many, I'd say. But if you
No.
could show your credentials in terms of your training, your education and training, such as HCA, and your professional membership of a body where it's robust, it's monitored, and you are called to account and accountability, then that's a much better bet. So that's the difference, and that's the message that we jointly need to get across. And I'm excited really to be working with all of our education and training providers on, an awareness raising and a story that takes our students from the time they register through the learning process, through graduation and beyond, into their professional development and career opportunities.
Mm. I guess that's one of the most challenging parts, or one of the challenging parts of being a health coach. The fact that maybe in the past it hasn't been that well regulated. And like you said, to the one extreme of the Wild West. So going out there and, saying I'm a health coach, there's some challenges that comes forward with that. So do you think also, do you agree that that's a challenging part of being a health coach, or anything else? What other challenges might show up for health coaches?
I think the lack of awareness of what a health coach is and
Yeah.
how they work, that's really important. Um, e- oh gosh. So yeah, I mean, everyone uses the term,
Mm.
but but when you ask anybody to really explain what that means, it's like, not really sure. Isn't it about a nutrition plan? No. Isn't it about, an exercise plan? Isn't it a bit of both, But we are in some ways ahead of our time, but we need to be, because we are the change makers. This profession is the agent of change in society that will underpin every sector where people are. Because let's face it, Zena, people bring their health into every aspect of their life. They
Absolutely.
don't leave their healths on the knees, but when they go to work, it's okay, we're better. They
True.
don't go to the gym or go to a spa or a leisure centre or I don't know, a place of worship, and suddenly they're different people. That health challenge goes with them,
Yeah.
and the need to look after their health goes with them. So I think one of the really key challenges for us as a profession is to relentlessly get the message out, to people, and keep underlining it. And our campaign this year, Take the Lead on Your Health, is designed to do exactly that, to help the public understand what options are open to them, to
Mm.
give health coaches the resources to be able to uh, look at this resource together and talk to their clients and prospective clients about their role and how it's different from a life coach or a business coach or an executive coach or a
Mm.
social prescriber or anything else that's out there that could be, or a nutritionist or whatever.
Mm.
Um, that's about the awareness raising. I think the other challenge is that new coaches will go out and want to tell people what they can do for them instead of having that consultation approach,
Mm.
about listening to what's important to that client and then working in the kinds of approaches that they can take. But
Mm.
I think one of the most challenging things is that holding space for complexity in a consultation. Human health isn't linear. It isn't, I have this problem, I come to you, you solve it. Yeah. Or you tell me what I can do to solve it. Because people might be, our client may come in, and you know this when they first present. They could be dealing with stress and trauma and financial pressure or family responsibilities. They may not be sleeping. They may not be keeping up with their work demands. They may be nurturing or cultivating a chronic illness. all of this makes their case complex, but we assume very often that what they present with is what they need help with.
Mm.
So it's very important, I think, as a health coach to recognize and to really, really get home to our clients that, issues take years. Years and years and years to get embedded into your physiology, your psychology, your social context. You can't undo it in 5 minutes.
Mm.
So progress may be slow, it may be up and down. And the challenge there is keeping the motivation going, keeping your holding the line with your client and not allowing them to rush you into doing something that you know isn't going to really help them. I think those are big. On the one hand, it's awareness raising and keeping that message not just to the general public,
Mm.
to hashtag ask for a health coach, but also to clinicians to hashtag ask to work with a health coach.
Yes, yes, yes,
The
absolutely.
system
Yeah.
hashtag use the damn health coach.
I like.
But this really, the professional maturity really for a health coach to recognize that this is a new profession. We are changing the landscape of how health is delivered, and we are giving it back to the public who are the experts in their own lives. That's slow progress, but it's the most important progress.
Yeah. No, I've often heard that, and some students have shared that with us before. It's difficult to go out there and offer a service if many people are not aware of what exactly you can offer them. And so you're saying that awareness is very important, but also our roles, how important it is for us as coaches to look at the bigger picture, holding that space, knowing that it's complex. There's not one size fits all approaches that we can take, but it's about really tuning into what's coming up for this client that is
Yeah.
sitting in front of me today and not making any assumptions. Like you said, when we come into the space thinking that, I'm going to offer you all of these solutions or options, compared to really just having that carte blanche, a blank space where you can really understand what's going on for this
Mhm,
person. So
mhm.
important. Mm.
I mean, I'll share with you that when I was first trained, I was so keen to get started, and I had this intake form. It's like this, you know, and I fiddled about with it. I made it my own. I did all the stuff. I sent it, out to the client. They took time with a food diary and everything. So I was a nutrition and lifestyle medicine health coach, and they would complete it, send it back, and then I would issue a plan of where it
All
would
right.
start. They would come and I would send it to them, right, next consultation is we're going to talk about this and see which parts of it you just, which are you drawn to? You can't do it all at once, which are you drawn. So of course they come back looking very glum, saying, it's hard, it's too hard, it's this, it's that. And after a little while, I thought, I'm doing this wrong. I am not doing this from a health coaching perspective. I'm doing this from an expert perspective.
Yeah.
So I decided to scrap the intake form, apart from the legals, the
Yeah.
obviously important information. And then I took the view that I was not going to believe a client when they came with a problem. I was going to let them voice the problem, let them explain what life was like with this problem and how much they wanted me to help them solve this program. And then I would ask them to, for a moment, set aside the problem. Just tell me about your life. Tell me about your family. Tell me about your work. Tell me about where you live.
Mhm.
Tell me about the things that worry you most. And it was nothing to do with the problem. And before very long, the client could see that the problem was a symptom, it wasn't the problem.
Yes. Oof.
And we used a different approach. And then I engaged all the kind of purpose, meaning, what is it that you want to achieve in your life? What's your big why? What's your little why? What's the most important why for you to go for at the moment? So they might have come from, I don't know, a nutritional therapy consultation or a medical consultation with a long list of things they've got to do, and they weren't going to do any of it because it didn't seem important. But the one thing that was important was that, I don't know, that they went out for a walk every day with their dog and thought about what was important to them. And that changed everything. Those small things, and especially this engagement with nature, with giving yourself headspace to really think and come up with ideas. And I would get texts or little videos, on the iPhone sent to me. Look, I'm at such and such water. I'm doing what, I said I would do. I'm out here. It's wonderful. I feel so different. And I thought, yeah, and this person came to, can you recommend some healthier breakfasts? It was nothing to do with, I mean, that is the joy, isn't it, of practicing and having the confidence to say to the client, look, bear with me, suspend disbelief. Let's put the problem just here. We know what it is, but let's just find out more about you,
And imagine,
That's, I think,
imagine the different outcomes. So compared to someone presenting the issue, and we're jumping in and we are, okay, let's look at different options and let's brainstorm the breakfast options compared to the approach you just explained, right?
Exactly.
It can't be compared. Have you ever wondered whether you could turn your interest in health and wellness into a meaningful career? At Health Coaches Academy, we train people just like you to become professional health and wellness coaches through our Level 5 diploma. It's a 12-month part-time course, fully accredited, and designed to give you the skills, confidence, and practical knowledge to help others transform their health while building a career you love. If this sounds like something you'd like to explore, visit healthcoachesacademy.com. Now, back to the show.
Of course, they were eating rubbish breakfast. I can't tell you, they were eating these blooming, what are they? I don't know. They're oatmeal in a packet that you put into a jug. You poured water on, not even milk, and put it in the microwave. Because every bone in my body, no, I'll send you a plan for this wonderful, it could change your life. What changed their life was going out for a walk with their dog near water, which is all the things that and green trees around, and that then gave them headspace. So when we did, of course, come back to their presenting issue, by which time they'd begun to think for themselves, I've read about this and I saw something, or I read a thing, what do you think they do now? How could I do that? So it was their ideas. I was helping them just fit them into life,
Exactly. And I think that's what you've referred to earlier. It's about whole person health. And so tell us a little bit more about that. I think you've already shared quite a bit on that, but how do you define whole person health?
Whole person health. Well, I think it's because we are whole people. We're not just the physiology or the mind or or where we live. We are whole people in our whole context, and we go through life with that context. So it is, health is, it's a never-ending journey. It's not a destination. It's from the cradle, or even before the cradle, to the grave. It's shaped by a whole host of interconnected elements that impact on us: biological, psychological, emotional, social, spiritual, behavioral, cultural, environmental, all this stuff, commercial determinants of health. All of these things interact in a really complicated matrix. I remember once, a few years ago, doing a workshop for GPs, actually in a Birmingham PCN, and I tried to draw a circle. Well, I did draw a circle with the interaction of all the elements of lifestyle. And it got so confusing that I had to stop them running out of the room when they realised that actually they had to understand that it was an interaction, that they couldn't just make a direct relationship between eat this, that will happen, that what they ate in the morning would determine how well they slept at night or whether they slept at all. All of these different, their stress levels would determine their motivation to actually go for a walk, rather than sit in a chair and slump into a depression. It's these kind of interactions that are really important. That's whole people. Whole people live whole lives in whole contexts. So, they don't exist within, in isolation of their relationships, the workplaces that they're in, the communities, their own identities, or the perception of their identity, and how much we know now how identity is a huge part of being stuck in a behavioral pattern, that especially with things like smoking and alcohol cessation, it's about working on your identity and how you want to see yourself, in order to be able to sustain the motivation. It's not willpower, it's this intrinsic motivation to create a new identity around yourself as a non-smoker or a non-drinker or whatever it is. So it's that's is the important part about the whole person health. So it's not that a health coach needs to be an expert in this, but they have to understand that each of these are interdependent determinants of that person's life.
Absolutely. And I think when we're missing out on a lot, when as coaches we're going in and we're thinking, okay, we're going to work on nutrition and movement, there's so much more than that.
Yeah,
Right?
absolutely. So
Be,
yeah.
emotional, spiritual, environmental. You spoke earlier about the the breakfast option and how it wasn't ideal. And of course, as a coach, or as a chef, I think it's even more something that is quite important to you, right? Thinking about the quality of food. You've mentioned you've been on this farm, an organic farm. So tell us more about that side of things. So you've been trained as a coach, and you wrote a book, The Real Food Solution. So tell us more about that.
Well, the real food, brazenly, here it is. Okay, the real food solution. And it's a treasury of wisdom for energy, vitality, and better health for you and your planet.
Beautiful.
Now, we know that we are part of this planet. We are not apart from this planet. So everything we do to our planet, we are doing to ourselves. We're not this superior race that can float, a few inches above the ground level or water. Unfortunately, that attitude has resulted in the kind of destruction that we've wreaked upon the planet, I'm afraid. But in terms of our food, it's very much about where do we start? How do we recognize that we've lost the ability to feed ourselves? We've invested that responsibility to a food industry that doesn't care. It's not their responsibility to feed us. It's their responsibility to return shareholder value. That's legal. That's their legal responsibility. So while absolutely I applaud all of those companies, all of those organizations, all of the parts of the food industry that want to produce healthier options that aren't destructive either to the planet or to the human, physiology, and mental health, as it turns out. I applaud that, but actually their responsibility is to return shareholder value, and we have to recognize that. So my feeling is what I think is so fundamental is that we've got to re-educate ourselves about what's important, why we should care about where our food comes from, not just for our own. We don't need to be nutritionists. We just need to understand the things that are grandparents and great grandparents and ancestors understood about what's important about human nutrition and what kinds of foods, not nutrients, not vitamins, not minerals, but what foods contain the kinds of ingredients within those vitamins and minerals that are important to health. And this is, of course, where the soil comes in, because we know that the soils are depleted, so they don't offer the plants the nutrients, so we have to care about this. We have to educate the population globally. We have to go back to the old practices. Third world countries understand much more about what's important about human nutrition. Even those countries that haven't got any, they do not have food. Their understanding is much deeper than ours. And we've got to get back to that kind of knowledge, that ancient wisdom about what it is to feed up. And then we've got to learn to cook, because it's no good bringing home a basket full of shopping and then sitting looking at it thinking, not sure what to do, and then looking in the cutlery drawer and all you've got is a plastic knife and fork where you've been eating your takeaways with your ding foods. It ain't going to work, people. It's not going to. You can get away with one pan, but you do need at least a cutting knife of some kind.
At least.
So that's what the book is about. It's about, it really is call to action and to care. A call to care about how your food is grown, where it comes from, how it's been produced, how it's been reared. If you eat animals, I think that that's an important conversation, and I've not taken any sides. And how you become a more conscious consumer about how what you're doing to put food on your plate is affecting the planet and your own health. So that's really the focus of the book. And just, I don't know when this is going to air, Zena, but if it airs before the 20th of June, on the 20th of June at IPM, the Integrative and Personalised Medicine Conference, there is a session at I think it's about 9:30 in the morning, called Unprocessed, Taking Back Our Plates, which I am speaking at and chairing, which is leading the conversation about people. It's all very well to talk about nutritional science, nutrients, vitamins, and all the really important progress we've made in understanding. But what about the need to cook food when you get it home? And the panel are all esteemed, experienced cooks, educators, and food activists that are long in the tooth and have a very important and quite a robust message to share with health professionals who are maybe focusing too much on the nutritional ingredients rather than where to get it and cook it.
Yes.
You
Will the session also be recorded for those who perhaps only listen to it at home?
No, but I might persuade my colleagues to do a webinar for us afterwards. That would be great, and then we could run through the whole thing again. It's really important to recognise that we're in the. It's got to be. Listen, when I wrote this line in the book, which is a few years ago, we were on the 6th generation that had lost the skills to feed ourselves.
Exactly.
And that's crazy. Absolutely crazy.
What an important topic, because I think I've had clients before telling me in the name of health, they choose a low carb processed product on the shelves, because they're thinking they're doing it for the sake of their health. But there's such a deep, so much that is missing. And I think that education firstly is important, but teaching people to relearn how to cook and to feed ourselves properly.
Yeah. Well, I mean, absolutely, there is this, this argument between, should we eat low carb, should we eat no carb, should we eat vegan, should it be vegetarian, should it be carnivore, should it be keto, should it be Mediterranean, should it be this diet, that diet, the other diet? Actually, if people could just learn to cook some basic meals, and prioritize them for at least a few days a week,
Mm.
we would be so much better off, and so would they. You know, the population's health would change drastically with that. But you know, we've gone so far down this road, it's going to take a big, big effort. But we do see the tide turning. You know, we do see the movement now in movements like chefs in schools that are bringing back, you know, school kitchens and trained chefs to cook in schools that are bringing back a mandate for not using processed meals. And there's a big pushback from industry, of course, because you know, they're going to be losing customers and money, and they're not going to be delivering shareholder value. Well, I say that's a good thing.
Yeah. Yes.
I say that's a very good thing, you know.
I think your knowledge is just amazing, Isabella. I think there's so much experience also that you've gained over the years. So I'm curious to know, has your definition of health changed over the years?
Um, I think it has. I think I kind of bought into health being absolute. You know, you're either healthy or unhealthy, you know. And then of course the World Health Organization had revised its definition of health, but actually, you know, I'm not sure I agree with that, because it does exclude people that have got long-term conditions and diagnoses. They can never be healthy, but of course they can.
Mm.
Earlier in my career, I suppose through my training and my roles, I focused on like physical or psychological or behavioral health, as isolated, you know, uh, and not really impacting one another. But then I think I see health now as interconnected, you know, like we said earlier, this health it's a never-ending journey. It's there's no perfection. We can't have perfect health because something will happen. We can't predict perfect health. We can have good health. There needs to be a distinction between us feeling fit and being healthy, because as we know, a lot of athletes are very fit, but not necessarily very healthy.
Yeah.
It's not, health is not an idealized standard, but it is for me deeply interconnected. You know, it's this emotional well-being, psychological safety, the relationships that we form. We know that relationships are more important than smoking, what was it, 8 cigarettes a day or
Yeah.
whatever.
Yeah.
You know, we know that the environment in we know, if we live in a deprived area where no one's got a job, when no one's got any hope, where the house, you know, our house is damp, where we can't afford to decorate it, where we can't afford to mend the roof, we aren't going to be healthy. You know, we may just be able to struggle through, but psychologically, we're not going to be healthy. You know, if we have no purpose or meaning, if we just go through life because we have to, because it's expected, because we're living somebody else's idealized life. You know, maybe parents have said, you know, we want you to have a profession and you've gone along with it, but it's killing you. How many lawyers, Zena, have we got? How many lawyers have we got that come into health coaching because they cannot any longer continue in a profession where it's wearing them out? How
Yes.
many doctors
Yeah.
have we got? How many medics have we got who are leaving medicine to become health coaches
Yes.
because they see that that's actually what they went into medicine for? So I think this whole idea of what does health mean to, it means what it means to you.
Yeah.
You can be disabled. You can be living in impoverished circumstances. You can be um, living in a relationship that you wish you weren't in, but you can still find a way of being healthy. You know, it depends what it is for you. For me, it's that health is what people say they want. It's their aspiration. You know, for me, my health is growing old without shuffling along and hunched over and having a stick and change. Have you noticed how so many old people totter from side to side? They've lost their gait.
Yeah.
That for me is health. It's being able to keep my mind alive
Yeah.
cognitively. It's being able to, you know, analyze information, to synthesize it, to write, to speak, to interact, to have the energy to, okay, I can't run. I've got really bad arthritis in my knees. I really hate it when they tell you you've got to do all these jumping jacks and lunges and God knows what else. Can't do any of them. But I can walk. And that for me is golden. Walking is golden. The Nordic walking poles help me walk twice as long on uneven ground, and it's wonderful. Static biking is wonderful. Um, I'm recently understanding more and more about the impact of art and creativity on health, on every aspect of our health, not just mental health. I think that's terribly exciting. Look, cooking is my passion. It's my mindful meditation. When I go into the kitchen, I am lost in what have I got in the cupboard or the fridge. And sometimes it's not that much, but I think I'm going to make a fabulous meal out of this because it gives me joy. To Herbs and spices are the key to kind of, inventiveness and creativity in the kitchen. If you think about it, you, as a young woman, if you didn't eat the same meal for the rest of your life, you still would not go through half the repertoire of the world's cuisine that's available to us all.
Yeah.
So think about how much people are missing in terms of their expressing that passion and the creativity in the kitchen, and then sitting down and eating with people that you love or inviting friends around for we've lost all of that. It's not the same when you go and get a very nice supermarket meal for 10 and just ding it all up and put it on the table, and then you've got your blooming, oh, I don't know, what is it, prosecco to wash it down with.
Yes,
Okay,
yes, yes.
there's a time for
I love
that, but
it.
let's get back to some of the real stuff,
Yeah. Yeah.
that we've lost.
I think you must have a brilliant health coach or something you're doing is working, Isabella, because you're absolutely radiant and I can see
Oh, well,
you
thank you
are.
very much.
But what a brilliant question. We ask that question to our students as well when they start out. What is your definition of health? What does health mean to you? And it's quite eye-opening when they see each other's responses. They kind of assume that this is what health means to everyone, but it's so different. And
Mhm.
that really is the starting point and what we should be curious about as health coaches. So, as a chef, I have to ask, what's for dinner tonight, Isabella?
Oh, goodness. Okay, well, for dinner tonight is something called yuk suk. Have you come across yuk
No,
suk?
I
So
haven't.
it's Chinese inspired.
Yeah.
And it's very simple and very delicious. And it's minced pork cooked with all kinds, dry cooked with all kinds of Chinese spices and herbs and, flavorings. No packets,
Yeah.
no packets.
Wow.
It's herbs and spices, Chinese style. Lots of ginger, lots of garlic, lots of chili and onions, carrots, what else? And then, the various Chinese influences. And it's dry cooked and eaten with either Chinese leaves or the crispy cos lettuce. So you have a bowl and you have your yuk suk, and then you have fresh, crunchy, either Chinese leaves or the
Yes.
the crispy stuff, and then you just pile it up and make a little roll out of it and eat it up. And you can have that with ribs, Chinese ribs, which I love,
Yes.
and they're equally easy to do. Just paint a bit of stuff on them, shove them in the oven, and they're good. But actually, what we're having this evening as well is we have some leftover roast beef. I promise I'm not a carnivore. I eat everything, everything, even vegan food. I eat everything, you know.
Yeah.
But we have some roast beef left over, so I'm going to
Mm,
titivate that up a bit
that
to
sounds so
come to the
good.
second
Sounds
course.
amazing.
Yeah.
And I can just see all those different textures and the colors and everything. It's going to be
Yes.
amazing.
See,
Yeah.
that's the thing, you know, the colour that this is
Mm.
what's so important about vegetarian food and including a lot of vegetables in your and salads and the mixture of, you know, raw foods to either include. That was something we were very much taught at Ballymaloe.
Mm.
Always, always, always had a salad with our, even if it was Irish stew
Mm.
and mashed potatoes and I don't know, whatever,
Yeah. Yeah.
cabbage, there was a salad with it, you know, and we didn't. I mean, we ate the salad with the meal. In France, they eat the salad, I think it's after the meal.
Yeah.
There's some nutritionists that are actually current in the media that say eat the salad before the meal because of
Yeah.
the fiber.
Yeah.
So just have the salad for God's sake because it's
A win.
lovely. Put some and do not buy dressing. You can make dressing in 3 milliseconds, you know.
Yes, yes, yes.
So that's what these are not hard things, are they, Zena, that we're asking people to do? But it does depend on offering them access to that real food, affordable access to that real food
Mm.
for their health and for the nation's health and for the exchequer's bank balance, really, you know, when we're saving people and we're saving, making those cost savings on treating them when they're unwell, but also equipping them
Mm.
with the means to cook the food and the means to, you know, afford it. Um, and actually, you know, recognizing there are so many people who don't have a cooker, and if they do, they can't afford the electricity.
Yeah.
What is that about?
Mm.
What is it about in this country, in the UK, particularly where we've got all those, you know, millions of children living in poverty or below the poverty line, where their parents are having to miss meals because they can't afford to put the food on the table. And when they can, what is it? It's processed food because it's cheaper.
Yeah.
So really, I think this is a really important part of the role of a health coach. It's not only about behavior change, but because of our underpinning knowledge base, because we do focus on that health knowledge and understanding, not so that we can be quasi practitioners, so that we can understand the importance of all these elements
Yeah.
that impact on people's day-to-day lives. Yeah.
Okay. But I mean, I can see how you light up when you talk about this topic, and I think you're just the right person for this.
Oh, thank you.
And it's a lot of education and but also that accreditation, putting quality health coaches out there so we can. I sometimes see when students graduate, it feels like we're sending an army of health coaches into the world. So very, very important work you're doing.
Thank you.
Where could people find out more if they want to know more about UKIHCA or anything else you've spoken about today?
Well, you know, obviously we've got website, so I encourage you to all, you know, have a look at the website. I'm sure we'll send links, I
Yeah.
guess.
Yeah.
And you know, it's a really informative website. There's lots there. So, you know, make a cup of tea, cup of coffee, whatever it is that you like to drink and have a little browse around that. You can join us as an associate or a student member if you are part of one of our approved schools, such as HCA. A full member if you're a graduate and you've never thought to join, very welcome to join. You can follow us on LinkedIn and Instagram, of course. You can sign up to newsletters and our ecosystem posts, which are all about. We write newsletters directly to our tribe, if you like, to our mailing list,
Mm.
but also publish them on LinkedIn that are more, you know, ecosystem context. You know, this is the role of health coaching. Why is it so important? And then, of course, the various platforms that you can see us on, such as IPM in June. So I mentioned on the 20th, that's not a UKIHCA event, but on the 19th of June, we have wall-to-wall health coaching conversations, where this year it's absolutely focused on helping health coaches get out there, get their messages out there, understand the corporate environments, understand professional maturity, and help them build their own brand. So that's what that event is about.
Exciting. Thank you. So if someone is listening today, perhaps as a student health coach, or someone thinking about perhaps signing up to become a health coach, is there maybe one last message or something you want to leave our listeners with today?
I think just to remember that health coaching is about behaviours, isn't it? It's about supporting people with their health behaviours, choosing different behaviours and making those sustainable. So the message is really remember that health is deeply human. That humanity, we must never lose that humanity. It must be protected above all else. So while we're evidence-based, we're science-based, we have all these tools and techniques, at the end of the day, it's about the person in front of us and the human relationship that we create with that individual. People thrive when they feel heard, where they're supported, where they're self-empowered, where they feel connected, and where they feel capable of doing something. And I say to prospective health coaches, to students and to graduates and to every health coach out there, this is your power. This is your impact as a skilled professional. This is what you need to retain. And this is why you're doing this training, to bring the human element and the relational element back in to healthcare.
Beautiful. Thank you. Health coaching is deeply human, and people thrive when they are heard. I absolutely agree. Thank you so much.
You're welcome.
Thank you for sharing your knowledge today, Izabella, and your perspective, and for the very important work that you're doing in this space. I really think that this conversation will leave a lot of listeners feeling both informed, but also more encouraged and motivated to go out there and make a difference. So thanks so much for taking the time to join us.
You are very welcome, and thank you for inviting me. I've really enjoyed the conversation.
It was such a joy. Thanks, Izabella. Thank you for listening. We hope you enjoyed this episode. Please feel free to share it with friends or family who might find it inspiring. And if you'd like more insights like this sent directly to your inbox, make sure to sign up for our fortnightly HCA Talks Health newsletter. We've popped the link in the show notes. See you next time.